Background music fades out. Scene transitions to a slide showing the structure of Enterobacteriaceae. Professor. Enterobacteriaceae, commonly known as enterics, are a large family of gram-negative bacteria that reside in the intestines of humans and other animals. These bacteria display diverse characteristics, making them crucial players in both environmental and clinical settings. They possess a unique lipopolysaccharide outer membrane, flagella for enhanced motility, and fimbriae for adhesion. Their taxonomy is based on biochemical and molecular characteristics, classified into multiple genera, including Escherichia, Salmonella, Klebsiella, and Enterobacter, to name a few. Professor, now that we have established the nature of Enterobacteriaceae, let's delve into their epidemiology. These bacteria are notorious for causing a wide range of infections, from urinary tract infections to pneumonia, bloodstream infections, and gastrointestinal illnesses. Enterobacteriaceae are ubiquitous in the environment, multiplying the risks of exposure and transmission. Contributing factors range from contaminated water and food sources to poor hand hygiene practices in healthcare settings. Age, immunosuppression, and underlying medical conditions also increase susceptibility to Enterobacteriaceae infections. Professor, moving forward, let's focus on the clinical presentations and manifestations of Enterobacteriaceae infections. These infections can manifest in various ways depending on the specific bacterial species involved and the site of infection. Common signs and symptoms include fever, chills, abdominal pain, dysuria, diarrhea, and cough. Severe cases can lead to sepsis, organ failure, and even death. Understanding the diverse clinical outcomes is critical for accurate diagnosis and timely intervention. Professor, now let's shift our focus to the laboratory diagnosis and identification of Enterobacteriaceae. Accurate identification of these bacteria is crucial for effective treatment and infection control. Laboratory techniques, including gram staining, culture, and biochemical tests, play a pivotal role in identifying Enterobacteriaceae species. Additionally, advancements in molecular diagnostics, such as polymerase chain reaction, PCR, and DNA sequencing, have improved sensitivity and specificity in detecting these bacteria. Professor, antibiotic resistance is a growing concern globally, and Enterobacteriaceae are no exception. These bacteria have developed various mechanisms to resist commonly used antibiotics, making treatment challenging. Mechanisms such as extended-spectrum beta-lactamases, ESBLs, plasmid-mediated resistance genes, and efflux pumps contribute to the resistance observed. Understanding these resistance mechanisms is vital in formulating appropriate treatment strategies. Infection control is vital in reducing Enterobacteriaceae infections in healthcare facilities. Key measures include hand hygiene, disinfection of equipment, isolation precautions, surveillance, and educating healthcare personnel. Let's work together to prevent the spread of these infections. Professor, now let's focus on treating Enterobacteriaceae infections. Antibiotic choice depends on the specific bacteria, infection site, and susceptibility testing. Multi-drug-resistant strains require careful consideration. Combination therapy and newer antibiotics like carbapenems and colistin are often needed. Pharmacist, stick to the prescribed antibiotic regimen and finish the full course to prevent resistance. Professor, as we progress, we must discuss the potential complications and sequelae associated with Enterobacteriaceae infections. These can range from local complications, such as abscess formation, to systemic complications like septicemia and organ damage. In some cases, patients may experience long-term effects, including chronic kidney disease, joint disorders, or neurologic sequelae. Vigilance in recognizing and managing these complications is crucial for optimal patient outcomes. Professor, let's now turn our attention to the emerging trends and challenges in managing Enterobacteriaceae infections. Rapid global travel, population density, and the overuse of antibiotics contribute to the emergence of new patterns of infections and resistance. The identification of emerging drug-resistant strains, such as carbapenem-resistant Enterobacteriaceae, CRE, and colistin-resistant strains, poses unique challenges in the clinical management of these infections. Ongoing research and surveillance efforts are crucial to staying ahead of the evolving landscape. Professor, as we discuss the impact of Enterobacteriaceae infections, it is important to highlight the unique considerations and challenges faced by vulnerable populations, namely neonates and the elderly. Both groups are more susceptible to severe infections and poorer outcomes due to their compromised immune systems. Neonatal intensive care units and nursing homes must implement stringent infection control measures to protect these vulnerable individuals. Professor, moving forward, we discuss the public health implications of Enterobacteriaceae infections. Outbreaks of Enterobacteriaceae infections, such as those caused by Salmonella or Shigella, can have severe consequences on a community or even a national level. Public health surveillance strategies, including timely reporting, contact tracing, and active surveillance, aid in identifying and containing these outbreaks. Public health interventions, such as food safety regulations and vaccination programs, play a vital role in controlling the spread of Enterobacteriaceae infections. Professor, lastly, we explore the future directions in research and therapeutic interventions for Enterobacteriaceae infections. Ongoing research efforts aim to develop innovative diagnostic techniques, novel antibiotics, and alternative treatment strategies, such as phage therapy or immunotherapies. Interdisciplinary collaborations between microbiologists, clinicians, and pharmacologists are key to advancing our understanding and conquering the challenges posed by Enterobacteriaceae infections. In conclusion, we have covered all aspects of Enterobacteriaceae infections, including their characteristics, diagnosis, treatment, and impact on public health. Stay informed to ensure optimal patient care. Good luck in your medical careers.